What is the history of blood pressure targets? Imagine a world where controlling blood pressure could mean the difference between a healthy life and serious health problems. That's what this story is about. It's a journey through how doctors and researchers have learned to set blood pressure goals over the years. Back in the late 1800s and early 1900s, doctors started measuring blood pressure with new tools. They found that high blood pressure was linked to damage in the heart and kidneys. But at that time, they didn't have many ways to treat it. Life insurance companies began measuring blood pressure to estimate how likely someone was to die early. Before World War II, there were few medicines to lower blood pressure. Doctors relied on diet changes like reducing salt and even surgery. Some early drugs like sodium thiocyanate were used but didn't work well. The death of President Franklin D. Roosevelt from untreated high blood pressure in 1945 made the public and doctors realize how dangerous it could be. In the late 1950s, a new class of medicines called thiazide diuretics was introduced. These drugs helped lower blood pressure safely and became a game changer. During the 1960s and 1970s, studies showed that treating diastolic blood pressure, which is the lower number, could reduce heart attacks and strokes. Doctors then aimed to keep diastolic blood pressure below 90 millimeters of mercury. In the 1990s, attention turned to systolic blood pressure, the top number. Many older adults had isolated systolic hypertension, which was once thought untreatable. The systolic hypertension in the elderly program showed that lowering systolic blood pressure over 160 millimeters of mercury cut stroke risk. This made controlling systolic blood pressure a priority, especially for seniors. In the 2000s and 2010s, large studies compared different medicines and treatment strategies. The ACCORD trial looked at people with diabetes and found that lowering systolic blood pressure below 140 or even 120 millimeters of mercury didn't always help. It showed that treatment should be personalized. Then came the SPRINT trial in 2015, which changed the game again. It found that targeting a systolic blood pressure of 120 millimeters of mercury in non-diabetic patients reduced death and heart problems significantly. This led to new guidelines recommending lower blood pressure targets for many people. Today, the focus is on balancing the benefits of lower blood pressure with possible side effects. The goal is to keep blood pressure around or below 130 over 80 millimeters of mercury for most adults. This history shows how understanding and treatment of blood pressure have grown, helping millions live healthier lives. Each step in this journey was driven by research, clinical trials, and a desire to prevent serious health issues.